Rheumatoid arthritis, RA, is a chronic autoimmune disease that affects millions of people worldwide, causing pain, inflammation, and joint deformity. Leflunomide, a disease-modifying antirheumatic drug, DMARD, is widely used in the treatment of RA. But have you ever wondered how leflunomide actually works to provide relief? In this video, we will delve into the mechanism of action of leflunomide in rheumatoid arthritis. By inhibiting the enzyme responsible for the synthesis of pyrimidine, leflunomide disrupts the production of cells involved in the inflammatory response. This reduces joint inflammation and damage, thus slowing down the progression of RA. Furthermore, leflunomide has immunomodulatory properties that modulate the immune system's response, leading to decreased inflammation and joint destruction. Its unique mechanism of action sets it apart from other DMARDs and makes it a valuable option in the management of RA. Understanding how leflunomide works can empower patients and healthcare professionals alike in making informed treatment decisions. So, join us as we unravel the intricacies of leflunomide's mechanism of action in rheumatoid arthritis, and gain valuable insights into its role in alleviating the burden of this chronic condition. Understanding the role of inflammation in rheumatoid arthritis. Rheumatoid arthritis, RA, is a chronic autoimmune disease characterized by inflammation of the joints. In a healthy immune system, inflammation is a protective response that helps the body fight off infections and heal injuries. However, in RA, the immune system mistakenly attacks the body's own tissues, particularly the synovium, the lining of the joints. This immune response triggers a cascade of events that lead to joint inflammation, pain, and damage. The synovium becomes thickened and inflamed, causing the release of inflammatory mediators such as cytokines and chemokines. These substances attract immune cells, including T cells and B cells, to the site of inflammation. Once at the joint, immune cells release enzymes and other substances that break down the cartilage and bone, leading to joint destruction. The excessive inflammation and tissue damage in RA can result in permanent joint deformity and disability if left untreated. Understanding the role of inflammation in RA is crucial for developing effective treatment strategies. By targeting the inflammatory processes, medications can help alleviate symptoms, slow down disease progression, and improve the quality of life for individuals with RA. Overview of leflunomide as a treatment option. Leflunomide is a disease-modifying antirheumatic drug, DMARD, that has been widely used for the treatment of RA. DMARDs are medications that work by modifying the underlying disease process rather than just alleviating symptoms. They aim to slow down disease progression, preserve joint function, and prevent long-term damage. One of the advantages of leflunomide is its oral formulation, making it convenient and easy to administer. It is effective as both monotherapy and in combination with other DMARDs, such as methotrexate. Leflunomide has been shown to reduce disease activity, improve functional ability, and inhibit radiographic progression in patients with RA. The safety profile of leflunomide is generally favorable, with the most common side effects being gastrointestinal disturbances and mild hair loss. Rare but serious side effects include liver toxicity and bone marrow suppression. Regular monitoring of liver function and blood cell counts is recommended to ensure the safe use of leflunomide. Now that we have a basic understanding of leflunomide as a treatment option for RA, let's explore its mechanism of action in more detail to understand how it exerts its therapeutic effects. Inhibition of pyrimidine synthesis pathway. Leflunomide works by inhibiting an enzyme called dihydroorotate dehydrogenase, DHODH, which is involved in the synthesis of pyrimidine, a building block of DNA and RNA. By targeting this enzyme, leflunomide interferes with the production of rapidly dividing cells, including immune cells involved in the inflammatory response. DHODH is primarily expressed in activated lymphocytes, particularly T cells and B cells. These cells play a central role in the pathogenesis of RA by releasing pro-inflammatory cytokines and contributing to the destruction of joint tissues. By inhibiting DHODH, leflunomide selectively suppresses the proliferation and activation of these immune cells, thereby reducing the inflammatory response in the joints. Impact on immune cells and cytokine production. In addition to its effects on pyrimidine synthesis, leflunomide has immunomodulatory properties that further contribute to its therapeutic effects in RA. It affects multiple immune cell populations and cytokine production, leading to decreased inflammation and joint destruction. Leflunomide has been shown to reduce the production of pro-inflammatory cytokines, such as tumor necrosis factor alpha, TNF-alpha, interleukin-1, Illinois 1, and interleukin-6, Illinois 6. These cytokines play a pivotal role in the pathogenesis of RA and are responsible for the recruitment and activation of immune cells, as well as the promotion of joint inflammation and damage. By suppressing the production of these cytokines, leflunomide helps restore the balance between pro-inflammatory and anti-inflammatory factors, thereby dampening the inflammatory response in RA. This modulation of cytokine production contributes to the overall therapeutic efficacy of leflunomide in reducing disease activity and joint damage. Clinical efficacy and safety of leflunomide in rheumatoid arthritis. Comparison with other disease-modifying antirheumatic drugs, DMARDs. Leflunomide is considered a valuable treatment option in the management of RA due to its unique mechanism of action and clinical efficacy. It has been extensively studied in various clinical trials and real-world studies, demonstrating its effectiveness as both monotherapy and combination therapy with other DMARDs. In head-to-head trials, leflunomide has shown comparable efficacy to other DMARDs, such as methotrexate, the gold standard treatment for RA. It has been shown to improve disease activity scores, reduce joint pain and swelling, and inhibit radiographic progression over time. What sets leflunomide apart from other DMARDs is its oral formulation, convenient dosing regimen, and favorable safety profile. It offers an alternative option for patients who may not tolerate or respond adequately to other DMARDs. It can also be used in combination with other DMARDs to achieve better disease control and treatment outcomes. Potential side effects and precautions of leflunomide. While leflunomide is generally well tolerated, it is important to be aware of potential side effects and take necessary precautions to ensure safe use. The most common side effects include gastrointestinal disturbances, such as diarrhea and nausea, and mild hair loss. These side effects are usually mild and transient, resolving on their own or with supportive measures. However, leflunomide has rare but serious side effects that require close monitoring. One of the most concerning side effects is liver toxicity, which can manifest as elevated liver enzyme levels or liver damage. Regular monitoring of liver function is recommended, especially during the first 6 months of treatment. Another potential side effect is bone marrow suppression, which can lead to decreased production of red and white blood cells and platelets. Regular blood cell counts are necessary to detect any abnormalities and adjust the dose of leflunomide if needed. It is important to note that leflunomide is contraindicated in pregnant women or those planning to become pregnant due to the risk of fetal harm. It can stay in the body for a long time, and a specific medication elimination procedure may be required before attempting pregnancy. Conclusion and future directions in leflunomide research for rheumatoid arthritis. In conclusion, leflunomide is a valuable treatment option in the management of rheumatoid arthritis. Its mechanism of action, which involves inhibition of pyrimidine synthesis and modulation of immune cell activity, helps reduce joint inflammation and damage in RA. Leflunomide has demonstrated clinical efficacy and safety in various studies, both as monotherapy and in combination with other DMARDs. Its oral formulation and convenient dosing regimen make it a convenient option for patients with RA. However, close monitoring of liver function and blood cell counts is essential to ensure safe use. Future research in leflunomide for RA may focus on optimizing treatment strategies, identifying predictors of response, and exploring its potential use in other autoimmune conditions. By continuing to unravel the intricacies of leflunomide's mechanism of action, we can further enhance our understanding of RA and improve treatment outcomes for individuals living with this chronic condition.